Welcome to Spotlight on Migraine, hosted by the Association of Migraine Disorders. In this episode, we learn about how weather and barometric pressure can impact people with migraine. Dr. Shivang Joshi discusses theories on why changes in weather can trigger migraine attacks and what people can do to minimize symptoms. Hello and welcome to Spotlight on Migraine. I'm your host, Molly O'Brien, with the Association of Migraine Disorders. Today, we're taking a look at a very interesting topic that many of you have probably wondered about. Today, we're looking at the relationship between migraine and the weather. I'd like to introduce our guest today, Dr. Shivang Joshi. Dr. Joshi is the Director of Headache Medicine and the Director of Clinical Research at Community Neuroscience Services. He's also Vice President of AMD's Board of Directors. Dr. Joshi, thanks so much for joining us today.
It's great to be here, and I know you're part of New England, and New England has all these sort of fluctuations of weather, so definitely really a real sort of impact on patients, at least in the New England area. So it's a very important topic, and this is something that I see day to day with my patients talking about it. So I'm glad we're talking about it, and it was great to recently publish a paper on this topic with a couple of my colleagues.
I'm so excited about this topic, and I know you are too. We can't control the weather, but it seems like it really impacts us, especially those for people living with migraine. But we're not necessarily sure that the research is there to support it. But thankfully, you've looked into that and you have some answers for us. So, very excited to have you here today. But before we take a deep dive, let's start off just kind of a basic idea. High level, summary kind of level, what do we know about the relationship between weather and migraine?
So the simple answer is, there's no definitive evidence that there's a direct link, but there's a lot of studies that have been done. There's animal model studies that have been done where barometric pressure changes, where they look at, certain levels of chemicals that increase during those episodes. There's some nerve activity that takes place within the sympathetic nerve. There are also changes within the parts of the brain that deal with our sort of balance or vestibular function. So there's a lot of theories on and mechanisms of how something like that could have a potential impact. We can also look at things like serotonin or maybe something like CGRP, which stands for calcitonin gene-related peptide, may play a role as well too. Interestingly enough, I just saw a patient who unfortunately had a lightning strike on their house.
Oh my,
And,
oh,
you know,
wow.
obviously there's headaches from that as well, dealing with stress. So there's so many variables that occur during weather-related changes, during lightning strikes and things like that. But one really interesting thing that came up doing this literature review was there was some mention of ionic changes, or ion changes that occur during whether it's a full moon or electricity, electrical changes. So I think that still needs to be explored, but it definitely is something that is scientifically interesting.
It's so interesting on so many levels and a lot to talk about. So, to kind of backtrack just a second here, when we're talking about migraine and weather, what weather components are we talking about? You mentioned a few, but what are we talking about? Are we just talking about it's sunny? Are we talking about wind changes? What are we looking at, and what did you look at within your review?
So that's the hard part is when you have a weather change, it just doesn't occur by itself. You can't have a wind change without sometimes not having barometric pressure changes. There have been scenarios where people have been trying to isolate sort of different unique things. So some of the factors include temperature, wind speed, humidity, and barometric pressure changes. So these are some of the main components. Additional things that you can add to that maybe include altitude sort of changes. We can also chat about um, patients who have headaches upon landing. So, when they're flying, when they're landing, they'll tell you that I have migraines when I travel. They're almost afraid to travel. So there's some remedies we can talk about as well too. So needless to say, there's a lot of different parameters. It's hard to tease out individual parameters and study them independently.
Yeah, because you can't control the weather. So controlling factors of the weather to research, I
Oh,
mean that,
trust
yeah,
me,
that
there are people trying to control the weather
if
with
only we
cloud
could.
seeding. I know, right?
Uh, all right. So now that we have a better understanding of some of the topics that we're going to talk about within that weather umbrella, so to speak, it seems like changes in weather, especially drastic changes in weather, like in New England, we can go from 40 degrees to 80 degrees in a span of overnight. Um, but does it seem to be that weather patterns or changes in weather is that more of the issue for people when they're dealing with migraine and weather?
I think you bring up a very, very important word, and that's change, right? So the brain doesn't like change. I remember this from my fellowship training. The brain doesn't like change. To give you a medical corollary, if your thyroid level is off, if your B12 is off, if your sugar levels are off, for example, if you're skipping meals, if you're dehydrated, your electrolytes are off, your brain doesn't like change, right? Especially the migraine brain does not like change. And so when a change occurs, whether it's atmospheric, for example, one of the most common things that I hear is when there's a rainstorm or a barometric pressure changes. The patients will tell you there's a barometric pressure change. So it's the change, when a different front is coming, that if you can anticipate that change, you might be able to, be prepared in advance. So, what these changes are doing specifically inside the brain, I think needs to be further studied. But the other aspect of change is temperature. So temperature has been studied hot or cold. When I talk to my patients, they'll tell you when they go from air conditioning to humidity outside or vice versa, it's that sudden change that triggers a headache for them. So I think change is very important, to study further and see if we can not create as much change in a quick period of time as possible.
That's so interesting. And it's funny because we had our followers ask questions as well, and just talking to people, and then myself being a person living with migraine, those changes. As soon as you said that, it's like, oh, yeah, hot to AC. Yep, that does it every time. um, so, and you touched on this a little bit. We don't know exactly how weather or weather changes can impact migraine, but do we know a little bit? And if so, what do we know? Kind of what is the mechanism of action?
Right. I think if you go back to just the mechanism of migraines, right? So we know that inflammation plays a role. We know that CGRP plays a role. We know that serotonin plays a role. We also know that there's activation of nerves, right? And we also know that it's not just one part of the brain, right? So recent studies show that the hypothalamus may be involved, that the brainstem is involved, the cerebellum. So there's different parts of the brain that are involved. There are vestibular functioning parts of the brain, and a lot of it is all connected and interconnected. So theories include um, sensitization of nerves, triggering events taking place, or with barometric pressure changes. Could there be some changes in the stress, I guess, the physical stress around nerve endings or around the dura? So the dura is the outer layer of the brain, and you have blood vessels and nerves, surrounding that. So if there's an atmospheric change, is it enough to irritate the lining of that? And a corollary to that would be someone who has, let's say, more of an immediate drastic change when they go from altitude. So
Yeah.
if you go from low to high or high to low, your brain is trying to adjust, physical parameters. So there's multiple different aspects in terms of mechanisms, but I don't think we've specifically identified one. So it could be a combination of things that are occurring more specifically in a migraine brain, which we already know is hypersensitized to some of these changes.
All right. So we mentioned before that earlier this year that you published an article, Why Weather Matters, in the journal Current Pain and Headache Reports. So this review you did was on all of the most up-to-date studies on migraine and weather. So let's talk about some of what you've learned from the research that's out there. And we've mentioned barometric pressure. What is it, and what do we know about how this can impact people with migraine?
Right. So, we looked at my colleagues and I looked at a bunch of different studies and a bunch of different settings. There's one study that actually looks at wind speed, and they're called the Chinook winds, Chinook area. or Chinook winds. So that was really interesting learning about that. So, different regions will have different exposure. For example, if you're living in Florida or Tampa, you're going to have a lot of humidity, you have a lot of hurricane. So atmospheric changes, when the pressure drops, um, it's something real. You can actually measure it. And one thing that I learned is that there are certain apps that are available. You can go on your local AccuCheck weather, put in your zip code, and they have an index, just like they have a pollen index, they have an air quality index. Some of them will have a migraine index. And if you can anticipate that the barometric pressure is planning to drop, usually the migraine index goes up and you can anticipate that and then treat early on and see if you can mitigate some of the symptoms. So, um, those are some of the things that we found. We found that it was very difficult to study as well. So those are some of the variabilities that we studied.
What do we know about temperature changes and humidity and their relationship with migraine? Because a lot of places will get big swings in temperature, which can be difficult. But what do we know? What does the science say?
Unfortunately, the science doesn't say much, but it could be just the way the studies were done. But in one particular study, it was about 60 or even higher than 60% of the patients who said that there is a relationship between, temperature or weather changes that really affects them. So it's possible that the studies weren't done properly. As I mentioned earlier, sometimes it could not be just a temperature change, but it could be, um, going the sudden temperature change from in and out of a building could be a factor. So with that comes humidity as well too. But you know, with that also comes if you're going from a dark environment, if you imagine you're in a dark environment and then you go outside to a bright, sunny, humid environment, you would assume that in the summertime, it's going to be more sunny outside, that maybe there's light is a factor as well too. So there's too many variables. I think that we need more information on temperature, humidity, wind speed, and barometric pressure.
As I'm listening to you talk about this, it really does make sense when you put it into that context of the migraine brain does not like change. So any bam in your face changes, whether it's light and dark or humid and dry air, hot and cold, um, it makes sense to me. So let's talk about severe weather. So we are entering hurricane season. There are big storms. Some people live in areas where there are tornadoes. You mentioned you had a patient that had a lightning strike on their house. So, what do we know about severe weather or massive systems and their relationship with migraine?
When you look at that from a broader perspective, it's a very stressful event,
Mm.
you know? So aside from, the variable changes that occur, right? So when you have a tornado or a hurricane, you can have barometric changes, temperature changes, winds, you can have a whole host of different things. But I think the important part here is how is it really affecting the human psyche, right? You're really stressed out. You don't know if your medications are available in the pharmacy. If you're in a tornado, you don't know if you have a roof on your head. So I think that the stress part probably plays a more of a component to that.
Let's change gears just a little bit here. I know you mentioned that these changes and weather changes can affect the vestibular system, excuse me. Do we know anything about whether or not people with vestibular migraine are impacted at a higher rate, or maybe they're more sensitive to these specific weather events or changes in weather?
Just waiting for you to ask me that. I think, since we're both part of this organization, AMD, there's a focus on looking at vestibular migraines. I think that um, part of it is that not enough vestibular migraine studies.
Yeah.
There's a big movement now to create more awareness. In fact, there's the HEADS registry, which looks at sinus symptoms and looks at other vestibular symptoms that are part of a headache, and maybe they're part of a migraine. And maybe that it broadens our definition or fine tunes our definition of what vestibular migraine is. So I think a lot of research is needed, but there have been some theories about um, nerves in the vestibular centers being affected during barometric pressure changes and storms and things like that. So I think definitely there's a scientific rationale that could be exploited there. Um, patients get very uh, dizzy, they have vertigo symptoms. There's a visual component as well too. A lot of changes occur during an acute climate event.
We've talked about weather. We've talked about weather and how it can impact migraine. And we've both mentioned that you can't control the weather, obviously. So, what do we do about it? If people are feeling like they are impacted by changes in weather, if there's a big barometric pressure change, well, we can't really do anything about that. It's going to happen. So, what advice do you give patients? What strategies do you have? Is there anything for when we know that a change is coming or there's going to be a weather event? Is there anything that we can do about it to either prevent a migraine attack from coming or to try to treat early? Like, what can we do?
You bring up a very important point, right? Which is, there's, let's say, limited science available on a certain topic, but you know that your patients experience it. And as a clinician, you can't just say, hey, there's not definitive evidence, so I can't help you there, right? So I think we always strive to look for evidence-based, data available. And in scenarios where it's not available, we treat empirically. So for example, we think about the mechanisms that may take place. So one example is patients who travel, right? So we know that inside the cabin there are acute changes in barometric pressure. We know that there have been studies that look at oxygen levels as well too. I mean, again, nothing definitive. So, but how is that affecting the migraines, right? So go back to the mechanisms. Migraines are associated with neuroinflammatory process, they're associated with CGRP, serotonin levels. So one advice that I tell my patients is sometimes they can take an anti-inflammatory medicine, whether it's ibuprofen or naproxen sodium, and they can take that before landing. So a lot of the data shows the majority of the times patients have airplane headaches. It's something you can find in one of the diagnostic criteria is during landing. So what I'll typically tell them is half an hour before landing to take an anti-inflammatory medicine. Um, Now, going back to again, trying to exploit the mechanisms, right? I have asked some of the patients to also try and take like a G-pen, and G-pens tend to have a longer half-life. So sometimes I'll have them take it, prior to flying. So by the time they land, depending on how long their flight is, that's another important question. I might have them take a G-pen and an NSAID together as well. And certainly, upon landing, if they have a headache, they would treat their headache accordingly. Um, some of the other strategies that my colleagues may also use is similar to the strategy used to treat high altitude sickness or high altitude
Oh,
headaches. So when there are climbers who are going up a mountain, sometimes they're placed on something called acetazolamide. Acetazolamide is a medication that's commonly used for high altitude sickness or altitude sickness, which involves pressure changes occurring sometimes too quickly for the brain to adjust. And sometimes it can create something called cerebral edema, and that creates headache and other bad stuff. So I have had patients try this um, during flying as well as around heavy times of weather changes. Sometimes they can take it almost on a regular basis, or sometimes they might be able to take it periodically. So there are some publications on this, but nothing is evidence-based. So we try to use as much scientific information that's available to us, and try to see if we can provide some therapy for patients without doing any harm. So
but I'm curious for people who have migraine that really notice they experience attack around weather changes. Do you have any advice for them to how to talk to their doctor about it? Because not everyone is working with a neurologist. Some people are just working with their general practice doctor. Is there a good way that you think people with migraine can approach this with their healthcare provider?
it's a very good question. And I think the best way to do this is to keep track, right? So you can download headache diaries, or if you don't feel doing that, there's some apps as well. Whatever you can do to record, and then when you bring that in to your provider and say, "Look, this was a weather change here. I had my headache here. There is a relationship here. It's not just something that I'm going from my memory and there's a recall bias there. I'm actually recording data, bringing it to you. So I think that's a great first step.
All right, Dr. Joshi, we're wrapping up our conversation. Is there anything else that you want to share with our followers and our listeners about migraine and weather?
I mean, weather is going to be so erratic, and you can only be prepared as much as possible. There's a lot of variables. I would say don't stress yourself out, you know, and don't maybe limit, let's say if you're planning a vacation, but you're not going to go because you're afraid that something's going to happen. I think that there are a lot of medications that are available now to treat migraines. So when they do occur, you can treat them effectively. There's a couple of little things that you can do prior to traveling to prevent that from happening. So I think keeping headache diaries, keeping track. I do tell my patients to go on to their local weather sort of app and find out when their barometric pressure change is occurring, and just to keep their medicines close by. So it does occur. Sometimes occurs, sometimes it doesn't occur. It could be a perfect storm, no pun intended, where you've skipped meals and you missed your dose of your preventive medications and the weather's changing and it's around your menstrual cycle. Uh, so it can create a perfect storm of events. So I think, it's to have basically to have some hope that this can be managed. And
Wonderful. Well, Dr. Joshi, thank you so much for joining us today and for all this wonderful conversation surrounding migraine and weather. We really appreciate your time and all of your insight.
thank you.
We really do appreciate your time, and to all of our followers out there, thank you so much for joining us. I'm Molly O'Brien, and we'll see you next time.